Thank you. The chair now recognizes the gentleman from North Carolina, Mr. Edwards, for any questions he may have.
Thank you, Mr. Chair. Chairman Ferguson, in 2019, the HCA Healthcare, the North Carolina's Mission Health, for $1.5 billion. My constituents in Western North Carolina were promised that this acquisition would result in lower patient costs. But after the merger, prices rose higher than the average list prices of the 11 neighboring hospitals, and annual markup prices nearly doubled to an average of 33 percentage points a year. Patients have also experienced a lower quality of health care, with a Centers for Medicare and Medicaid Services report finding that at least 3 patients died and more were endangered at the merged hospital in 2022 and 2023 due to significant wait times, delays, negligence, and lapse of care. Despite this significant decline in quality of care, Mission's patient care profits were almost $100 million in 2022, 3.5 times higher than its profits the year before the acquisition. Chairman Ferguson, in our previous meeting, you expressed similar concerns regarding the increasing prices of healthcare in rural areas as a result of private entity roll-ups and mergers. During your tenure as FTC chairman, what actions can and will you take to protect competition within the healthcare industry?
I enjoyed our discussion, Congressman Edwards. As we discussed, and as I've discussed going back to my confirmation hearing, rural healthcare in particular is super important to me. I grew up rural and saw a company come in and buy up a lot of physician practices, and so I've seen the effects of it. The commission has a pretty remarkable track record of policing hospital mergers. We don't get them all right, but it's one of the things the commission is better at than almost anybody, anything else that it does. I know you've asked for a briefing on the HCA merger, and I think we've set it up with you. In terms of what we can do, so the commission's first antitrust enforcement action since I became chair was in the healthcare industry. It was to block a merger of 2 medical device manufacturers that we allege would have increased prices. We have ongoing litigation involving PBMs. We have the PBM report. I think continuing to make sure we've also advocated against certificates of public advantage in states that allow hospitals.
So in your interest of time, respectfully, He's only going to give me 5 minutes. What can you do going forward to ensure that rural health care in America is protected?
We will continue to police hospital mergers as effectively as we've done for the last 2 decades.
How can you use your role as a federal regulator now to review the HCA and Mission Healthcare merger and take the necessary actions to reverse it if you determine that it's inhibited competition within the healthcare industry in Western North Carolina?
The commission doesn't approve mergers. If the commission declines to bring an enforcement action, it isn't an approval. So the commission always continues to monitor competitive effects in markets even after there are mergers that are not blocked. I'm happy to work with you and your staff, and my staff are as well, to understand the effects that the mergers had on rural North Carolina.
Thank you. I appreciate that. And in the interest of time, I'm going to accept that offer and let's work together. Now I'd like to ask, I'm informed that you may intend to file an amicus brief in a Texas Attorney General's case that would, if successful, cause asset managers to divest from the coal industry. Can you speak to that real quick? Is that true?
So the state of Texas, along with a coalition of Republican attorneys general, brought a lawsuit against asset managers and accused them of having driven up the price of energy by driving down output in coal and oil, which, if true, is sort of a shocking, horrible thing that has been inflicted on all of us by driving up our energy prices. We have monitored, us in the Department of Justice have monitored this case closely. I think this was an important and groundbreaking case brought by Attorney General Paxton, and if true, could potentially remedy increasing energy prices by making sure that asset managers can't collude to drive down output and increase prices.
And so, real quick, because I'm running out of time, how does that support President Trump's energy policy?
President Trump has made it one of his chief priorities to unleash American energy so that prices for energy go down, which it promotes growth, makes it easier for all of us to put gas in our cars. The accusation in that case is that asset managers were colluding in secret to drive up our energy prices. That is exactly the sort of thing the antitrust laws are designed to protect all Americans from. And we have monitored this case very closely.
Thank you, Mr. Chair. I must yield. I'm out of time.